Well, welcome. Better late than never, but as my dad said, better never late. So welcome to Jannis's live Facebook chat with myself, Dr. John, nurse practitioner with Island Direct Primary Care. So Jannis, thanks for having me. You look wonderful today, and I love that smile. So thanks for sharing with everybody.
Thank you.
What are we going to talk about today?
Well, we're going to talk about a very hot subject. So we talked about this before, and that's the COVID vaccine. And it is our most popular video for understandable reasons. And I've seen a lot of information out there about a lot of conflicting information, a lot of conspiracy theories, a lot of fear, a lot of getting behind it. I mean, you can go any way you want to go, you can find something to support it. And so I thought, you know what, we need to talk about that again because we had such a great conversation before, but it was before everything was kind of really happening. Mm-hmm. And now it's been like, how long? Do you know offhand how long it's been since the first vaccinations rolled out? I don't remember.
Oh, the exact
Of course,
date?
The last couple of weeks have been. Yeah, no. Just like, I mean, it's been a couple weeks, right?
December.
I'm checking to see.
December
if
was
we're
when
actually live.
December was when they first started doing some vaccines. I mean, outside of the trials.
Oh, really?
Yeah.
Okay, we are live. Very good.
We're live. I saw us.
Okay. Well, I don't like to be rude. It's rude to look at my phone while I'm talking with you. So I was explaining to everyone why I was doing that because I'm not usually rude. Because this is such a hot topic and so many people are thinking about it. And there are a lot of people out there that are on the fence about whether they should go get the vaccine or not. And maybe they've heard some things that are distressing to them. And so this is a great opportunity for them to ask you what your opinion is. Because at the end of the day, no matter how educated you are, and you are educated, far more educated than I am, I concede to that all day long. Although I don't always act like it. I do understand it and respect it. But no matter how educated you are, there's still going to be a certain level of opinion that has to go into the decision about whether you get a vaccine or not. So that being said, first question, have you gotten the vaccine?
Yes.
Yeah.
I got the vaccine I got the vaccine last week at approximately 4 o'clock last Thursday, 4 p.m. And and so the rationale for me, because this is still a new vaccine, it's a new technology. There are still a lot of unknowns, though there's a lot of research based off the way the vaccines have been developed and those kind of things. And that's a more detailed conversation when you get into some of the specifics. But in general, for me, I don't have a spleen, okay? And so your spleen is what your spleen's a blood filter, but it helps produce white blood cells and antibodies. It's part of the immune system. And I don't have one. And so I've been extremely blessed over the years that my body's other parts of my body have actually helped me fight off disease. But, I spend a lot of time in the emergency room and urgent cares. And more than once, I was exposed to a patient who wasn't forthcoming with their diagnosis. And it put myself, my family, and my patients at risk. And so about 10 plus years ago, I guess, I started getting vaccines again. I was never sick, so I never just really worried about it. And I didn't mind if I got sick because then I would build natural antibodies. But when I realized that when John gets sick, if I get one of these other things, I'm going to get more sick than others. And so looking at my community, I mean, I have, I'm almost getting ready to start a wait list for my practice here. And so we've had a good kickoff to the new year. And so then we'll be bringing on another provider. So right now it's just me. And so if I get sick, that's hundreds of people who don't have a healthcare provider. If I get sick, my family doesn't have someone who's supporting them. If I get sick, the largest urgent care in Brevard County doesn't have my my clinical research background available to them when it comes to studying the virus. And so me getting sick is kind of a big deal. And so I got the vaccine, and so it was a risk benefit thing for me. I'm a freedom of choice guy, and so I'm like, you know what? Based off my age, if it's something that's long term, I'm lived a great life. So, but at the end of the day, the benefit for me was a little different than just looking at the percentages. And you know what I mean?
So there's a lot of fear. I'm feeding back. Did you hear that? Can you hear that feedback?
I don't get the feedback.
Yeah, no, I can hear it. It's okay. It's all right. Hopefully it's not too terribly bad on the stream. Anyway, so I just keep checking that to make sure there's no comments. There's not anyone actually actively watching us right now, but they'll come back and watch. So a couple of the questions that I've had, I just want to ask you your opinion on these things, because, again, like I was saying, there are a lot of opinions. So your opinion was you decided that even though you don't have a spleen, it was advantageous for you to get the vaccine to reduce the likelihood that you would end up getting COVID. Is that right?
So just remember about what's interesting about vaccines, especially these viruses, people have this misunderstanding that if I get the vaccine, I can't get the virus, and that's not true.
Okay. Right. And there have been a lot of, I've seen a lot of people who have said, oh, look at this person who got the vaccine, and then the next week they got the virus, and, and they're using that as ammunition to say, don't even bother to get the vaccine.
No, so what happens is, the vaccines are there to build up antibodies, and those antibodies are there to keep the virus at bay. So you may end up getting sick and not even know it. You may get sick and not have it as bad. This is really common with the influenza vaccine, right? And so the percentage of people who it's a 46% depending on the year effective vaccine. So people are like, well, if it's 46%, why get it? Well, you know what? You ever seen that social media thing with that guy hooked up to the electrodes and acting like he's having a baby? You know which one I'm talking about?
Oh, yeah.
Where they keep shocking him so that he can have the experience that a woman has, and he's just going nuts. So some people just can't tolerate. Some people they can't handle the man flu, right?
Yeah.
Their temperature goes above 98.6 and it goes to 99, and they start freaking out and they want to call out from work and all that other stuff. So you get the vaccine, the symptoms are supposed to not be as bad.
Right. So, okay. So let me think of what I want to ask you without getting too crazy about it. Okay, what have you heard or what have you seen in terms of negative after effects from getting the vaccine? Because that's one of the things that, right? Like that's one of the things that people say, oh, don't do it. It'll kill you. It'll make your leg fall off. It'll make your eyes fall out,
Right.
So
well, you remember the first time we talked about
this.
Deal? Yeah, the first time we talked about this, I believe someone made a comment about autoimmunities and this dangerous and that dangerous. And I'm like, great feedback. Show us some literature, show us some, show us some resources, right? Because we want to do it. So that's always important. So what I'm going to do is really talk about my experience here because my dad has stage 4 esophageal cancer and he's had the vaccine. his caretaker's
Okay.
girlfriend. They got it. My mother, who had thoracic surgery and she had a breathing disorder, she has stents in her trachea and bronchioles, so she's gotten it. My son had COVID and he's a frontline healthcare worker. We gave it to him. And then my wife has an autoimmune disorder, Hashimoto's, and we gave it to her. She wanted it. And then I got it.
Okay.
And I don't have a spleen. Okay. So I think that I can speak on behalf of them of what their experiences were. So my dad had a sore right arm. And it may be sore because I punched him right before I did it, but not really. But so my dad had a sore right arm. His girlfriend had a sore right arm. My mom had a sore right arm. Her husband had a sore right arm. I had a sore right arm. My wife had a sore right arm. And then my son, who's number 7.
This is sounding terrible.
My son,
Sore right arm.
At 24 to 48 hours was the sore arms. And my son had the man flu. So what do I mean by that? So what kind of, he had flu symptoms. So he had headache. He had fever, 101.2, 101.4. He had chills. He had some vomiting. He actually had flu-like symptoms. And so I came into work the next day and I heard from the chief operating officer from where he works. And she goes, you know, Logan called in today. And I'm like, no. Yeah, he's sick. I'm like, bull crap, he's sick. I said, tell us, get his butt to work, you know? And, you know, I'm the empathetic nurse, doctor nurse, except when it comes to my son, I'm like, rub dirt on it, dude. You're in healthcare. Get out there and fight the good fight.
Yeah, that's not very nice.
I wasn't very nice, to be honest with you. I'm like, did you get to see by provider? Did you go get looked at? And no, sir. I'm like, you need to take your happy Humpty Dumpty to a clinic and get checked out. Well, why? And I go, well, you've already had COVID. You've had the flu. So you need to see, is this influenza? Is this strep? Is this mono? Is this COVID? You know, SARS-CoV.
Right.
You know, is this something? Are you actually sick, or is this a side effect from, you know, the actual vaccine?
Right.
You know, and then, yes, sir. So he came in the next day, and he had nothing. So we said, okay, well, more likely than not, it was side effects. So he went to my house and slept all day and ate my food and then went to his apartment. And then the next day he went to work because I told him he was fine. But
so he was tested for COVID and he did not have it.
He has antibodies too. He has IgG antibodies already.
Because he already had it previously. Okay, so in summary, so you can attest to 6 people personally that you have seen get the vaccine and what the side effects were, the after effects of getting the vaccine. 5 of them had a sore arm. 1 of them got
6 and then 1, yeah.
Okay, so all 6 of them had a sore arm, and then 1 of the 6 got a flu-like after effect, but it was not COVID. It was not the flu. It was just flu-like after effects, which also happens with the flu vaccine, right? Like, yeah, but most people don't get anything, but some people do get flu-like symptoms after.
Here, one of the things that I'm looking into now, and I find interesting is, so I participate in giving about 200 vaccines myself, along with, well, really, to be honest, so the chief marketing officer, the owner of MedFast, because these were for our staff, he actually gave them, it was him and I, we gave them ourselves. We didn't bring in nursing or anyone else.
200 vaccines.
Yeah. And what's interesting is there seems to be a correlation to those people who had COVID. The people who already had COVID had more side effects than the people who never did. And that's kind of correlates with what the literature says in what people who've had their second COVID vaccine, you know, because there's 2 shots. We've talked about that before, right? day 1 and day 28
Yes.
for the
I wanted
Moderna.
to talk about that also.
Yeah, and
Yeah.
and we had the Moderna vaccine, so day 1 and 28, and then the Pfizer's day 1 and day 21. And so what we're again, the research hasn't been done on it. We got to kind of do a retrospective analysis to kind of see, those people who missed work and stuff like that, what symptoms did they have. So we got to look at it backwards. But was that part of did they have COVID in the past? Because people are saying on social media right now that the first shot was no big deal, the second shot kind of knocked them down for a couple days. And I think that's important for employers to know.
Okay, that's interesting. That's interesting. So your son, who had the side effects after the first, he hasn't had the second yet, correct?
No, we'll get the 17th, 18th of February.
February. 17th. So we'll revisit this after that happens.
Yeah.
So
yeah, and one of the neat things that I'm doing
with perspective.
What I'm doing with a small sample size is we're doing antibody tests every day to see how long it takes us to start building antibodies from the first injection.
Oh, nice.
Yeah.
Nice. That's really great. That's good.
Because it's a small sample size, but nonetheless, it's something interesting to talk about. And I can say, look, this is what I see versus this is the bull stuff that we're reading from both sides.
So we have a handful of people who are watching live. And I just want to tell you, if you're watching live and you have any questions about the COVID vaccine, feel free to put them in the comments. I am trying to monitor, so you may see me, look down every once in a while. I'm just trying to monitor to see if we have any comments or questions. So we don't usually do that, but we're working on it. And yeah, absolutely. And we've got some new tools that we are going to incorporate next week. I was hoping to do it this week, didn't get it done, but we're here, usual, like we normally are. But I'm excited about, how we're moving forward. So to recap, Dr. John has had 6 people personally, himself included. Oh yeah. See, now you're confusing me. Don't do that.
I forgot. No, my mom's husband. My mom's husband was part of that group. So.
All right. So did we go to 7 now?
There's 7. There's 7 in that group. Yes. My personal family, basically. Well, I can actually add my sister in there. That would be 8. And so she had just a sore arm also. So out of the 8, we had 1 who had more than a sore arm as far as a negative response to the vaccine. And it lasted about 72 hours. And he actually happened to be the only one who had COVID previously. And
and so we've identified that appears to have an impact, and it does appear that people who have had it previously are potentially, you notice how I'm using like all of these like vague words, potentially are more susceptible to getting a flu-like reaction to having the vaccine.
Even in research, it's why we say more likely than, or we want to talk about a certain level of significance, right? And that's part of that's the cool thing about research is you can kind of say, here's the numbers, and when you look at the numbers and you do a statistical analysis of it, you can say with the certain level of significance, it was plus or minus. And I tell my students at UCF, because I teach in grad school, I'm like, whatever you do, don't ever say prove. You can report,
right?
You can reveal, right? You can show the numbers, but there's nothing proven, because we live in a wonderful society. Human beings are extremely smart. The US has lots of people who have the freedom to go out and invent and be innovative. Someone's going to come right back behind you and show them that that's not right. I found this.
Right. So, all right. So let me say this. So one of the things that I have been saying to people lately, first of all, I have to point out your window back there. I love it so much. Is it Good Morning America that has that they sit in front of a window and there are people who line up? You know, I have a friend who's been threatening to come and do
Put a sign up.
unacceptable things. Yeah, like embarrass us. But it's amazing. I can barely like keep my focus because I keep watching cars go by and people go by. It's great. I love it.
You want me to shut it?
I love it. It's perfect. No, leave it, leave it. And totally, one day someone is going to show up and they're going to put a sign in the window or do something inappropriate. It's going to happen. Just so you know, it's going to happen. And I'm kind of looking forward to it. I'm going to pull this back up again. I know. I'm not. You know, I get embarrassed very easily, as we have established previously. But I'm not a prude. I just get embarrassed easily. So, okay, we're going to skim right past that. So this is what I'm telling people. Because, yeah, I'm not a doctor, but I do like giving advice. I do it quite frequently. So here's what I like telling people lately is talk to your doctor about it. You know, don't make decisions about what you see on social media, what people are posting or saying, or, you know, because there's so much fear-based information on both sides of the topic, whether it is, you know, pro-vaccine or anti-vaccine. You know, you've had the vaccine. I have not had the vaccine. I need to talk to my doctor. I need to talk to my doctor and have a good conversation about whether I should get the vaccine or not. And when I do that, I'll make that decision, but I haven't made that decision yet. And it's a private decision for everybody. But at the end of the day, shouldn't people just talk to their doctor about whether it's a good idea for them to do it or not?
Absolutely. And I think people often don't because they're afraid of being judged, and that makes them frustrated. And I was just talking to someone yesterday, you know, a new patient, and she was like, you know, I went to my provider and told them that I wanted to do something more holistic, more natural, and they're like, oh no, and it was just, but that was the choice they had because of their insurance and all that. And because I don't deal with insurance companies, you know, they found me, and so I take care of them now. And it's just like, look, let's just talk about it. Let's make an educated decision. I'm just going to lay it out here. Here's what I know. I read this body of evidence, and here's the holes in it. Here's the not holes in it.
Right.
And, you know, I wrote an article in Merritt Island Now that was published this month on information overload, and it really discussed about how much information is being provided on social media that's inaccurate and that's not.
And it's a problem. It's a huge problem.
So, and people are just, oh, you know, I read it, so it must be true. Hi, Mom. But anyways, you know, because
ooh, you're gonna be in trouble.
Yeah, I love her, but she does it. And so what I did was just kind of provide some pearls on, you know, how to determine what's reliable and valid information, or at least try to narrow it down. But you hit the nail on the head. Ask your provider. If your provider is not willing to sit down and be an intelligent communicator with you, non-judgmental. If he's not willing to do that, or she, find someone who will. You know, I have
That's some. Right. I was going to say, not only is it a judgmental issue, it's a trust issue. Because I know in the past, I have not always had healthcare providers that I trusted. And unfortunately, and this is another subject for another day, but unfortunately, there is a real trust problem. And COVID has just complicated the devil out of it. You know, I'm dealing with a family member that's in the hospital right now in very precarious situation. And it has been an absolute utter nightmare. And I have seen firsthand the effect that COVID has had on healthcare providers, and they're so stressed. And, I'm trying to give grace to them for, what they're going through too, but it's tough. It's tough out there dealing with your healthcare provider. So yeah,
It
if
is.
you don't
And
have one you can trust,
we're out
find
here.
a new one.
Find a new one. Yeah. I got exposed 6 times Saturday morning alone by noon. It's real stuff.
Okay, we're going to wrap this up. I'm tired of talking about
Wrap it up.
I'm never tired of talking to you, but I am tired of talking about this. So we didn't have many people watching us live today, so we didn't get any live comments. But if you're still here and you have a question about this subject, feel free to put it in the comment section, and I will see it. Dr. John will see it, and you're pretty good about chiming in and answering those questions. I appreciate you doing that.
Yeah, and if the one young lady that asked about the anti-inflammatory diet, so I have it, not foods. I actually have something in PDF that I provide my patients stuff. I'm just trying to find a way that I can post it on that Facebook link. So I'll post it in a comment somewhere somehow, or I'll get it to you and you can post it. But yes, absolutely, okay. I'm willing to share any of the resources that I have or come across. So I think it's important.
Yeah, I appreciate it. I really appreciate what you do. I appreciate you showing up and sharing your expertise and your knowledge and your experience and what you're seeing out there and all of that. It's good. It's good stuff.
Well, thank you. And if anybody has any questions, they can reach me at john@islanddpc.com and I'll respond to their email. And my website's www.islanddpc.com. Just published a new website last week. So take a look and see what Island Direct Primary Care is all about. Thank you.
And I actually put all of this information in the description this time. I'm telling you, every week I get better and better and better all the time. So I put all of that information in the description if you want to look at that, and tune in next week. Guess what we're going to talk about next week?
What?
They finally got the sample at the testing for the allergies and sensitivity. I haven't gotten the results yet, but I expect them any day. And as soon as I get them, I'm going to send them to you, and then we're going to talk about them next week.
Send them to me before, not 5 minutes before.
Yes, sir.
Thank you.
Yes, sir.
Have a blessed day.
Have a great day. Thanks. Bye, everybody.
Bye, guys.